Welcome, everybody. All right, I'll let everybody trickle in and then start with my announcements for today's webinar. All right, I think everybody may be in the room with us. And as people trickle in, welcome, welcome. All right, good afternoon, everybody, and welcome to our 5th annual Gynecologic Cancer webinar series. I'm Rachel Rosen Simpson. I'm the program manager at the Breast Cancer Coalition. And I'm so glad that you could all join us to learn more about management strategies for scar tissue and lymphedema with our 2 amazing hosts, occupational therapist Melissa Clark and massage therapist Paige Torrens. We're so grateful to the Saunders Foundation that supports coalition educational offerings like this series because we couldn't do it without that support. Before we begin today's presentation, I have a few housekeeping announcements, as I always do, to share. Closed captioning is always available at the bottom of the screen if you click the CC button. I will facilitate a Q&A session following the presentation. So as the presentation unfolds, please type your questions into the chat function, and I'll continue to compile those, and we'll share them at the end with our amazing presenters, and we will answer as many as possible before we try our best to wrap up by noon. Just a disclaimer that our presenters cannot give any specific medical advice for an individual case during this short time we have together. So if you could try to keep your questions as broad and inclusive of others, that would be much appreciated. If you want to watch the presentation again, it is being recorded and it'll be uploaded to our webinar library as well as uploaded to our YouTube channel. I will drop both the link to the webinar library as well as the link to register for the future Wednesday webinars into the chat for your convenience. And I'll share the link to follow along with the slide presentation today. So lastly, there will be a survey that pops up on your browser at any point when you leave the webinar, and we do utilize all of your anonymous feedback when planning our future offerings. So please complete that survey if you're willing to. I promise it will guide us in the future and help give me ideas. All right, today's special guests, Melissa Clark and Paige Torrens. Melissa is a multifaceted, licensed and registered occupational therapist with over 20 years of clinical experience. Her expertise has spanned school-based pediatrics, geriatric acute and long-term care, oncology and breast cancer rehabilitation, and lymphedema therapy. Melissa is a certified lymphedema therapist and helps to facilitate the lymphedema and lipedema discussion group here at the Coalition. Additionally, she helps support folks on estrogen blocking medications as an integral presenter in our very own Surviving and Thriving on Aromatase Inhibitors program here at the Coalition as well. And she's a cancer thriver herself and understands the challenges both personally and professionally. Welcome, Melissa.
Thank you.
And Paige has been a New York State licensed, nationally board certified massage therapist since 2012. In addition to traditional massage therapy, she is certified in manual lymphatic drainage and in Reiki. She also has specialized training in oncology massage and myofascial release and craniosacral therapies. And when she's not at her private practice, she is an inpatient and outpatient oncology massage therapist for the U of R Medical Center. And we used to work together at the Outpatient Infusion Center at Highland Hospital, where Paige would offer massage to anyone receiving chemotherapy, as well as any visitors and supporters present. And it's a joy to see you always. Welcome, Paige.
Thank you.
We're so grateful to both of you that you could make the time to be with us today. So without further ado, take it away, Melissa and Paige.
Thank you. There we go. Okay. So today we're going to focus on the management strategies and scar tissue for lymphedema, or for scar tissue and lymphedema. And one of the things that's been wonderful in the last years is we've had wonderful success with cancer treatments, and people surviving after their cancer treatments and thriving. But sometimes we overlook some of the long-term side effects of those treatments, especially in gynecological cancers. And one of the big things we're going to focus on today is scar tissue and lymphedema, because these can actually have a significant impact on your comfort, well-being, function, So we want to kind of give you guys some strategies today to help you along. But first, I wanted to talk about what scar tissue is, what are adhesions, what's going on in your body after they've done the surgery or you've had radiation, because that scar tissue changes and how we feel about the scar tissue, how it feels, and how the tissue around it functions. So scar tissue is made up of this tough fibrous tissue that that happens naturally to replace the damaged skin. It's primarily made of collagen and fibrin, and it lays down differently than your normal tissue does. And you can see it like externally, or sometimes below the surface, you can feel it. Adhesions, we find a lot in our gynecological cancers, is where those fibrous strands of tissues form around the area that was damaged from surgery, but then sometimes it binds to the organs that are adjacent to that tissue. And usually those tissues are separate and function on their own. But when those adhesions come, it's kind of like the stickiness, that glue that kind of brings them together. And we see that sometimes involved with abdominal and pelvic organs. So our internal and external scar tissue that forms, you can have mild discomfort, you can have complications in mobility, the movement of the area that was damaged, sometimes organ function. And sometimes it doesn't happen right away. We notice it weeks, months, even years out. Patients will be like, oh, I can't walk as well, or I can't move this part of my body as well. And we find out it's because of that scar tissue has kind of tightened up around those muscles and joints. So with the internal adhesions, especially in that abdominal pelvic cavity, they act like glue, and they end up restricting the movement and the function of those organs. And last week, you had a wonderful presenter for your pelvic health that probably talked more about that. But when we're looking at somebody's ability to move and to function, us therapists can also help sometimes externally those internal adhesions, because what we want to prevent is that chronic pain that can happen from those internal adhesions. If you end up having radiation after the cancer surgery or before the cancer surgery, and they have to do radiation, if it's an external beam radiation, it damages the cells. So it kills the cancer, but then it damages the cells around it. And what radiation fibrosis is a result of the inflammation that's triggered by that process. And that inflammation causes more production of collagen and fibrin in the scar tissue, just like when you had the surgery, it caused that production of collagen. And think of it as like thick, sticky stuff. And when you're dealing with radiation fibrosis, over time, the tissues harden more and it becomes harder to move and thicker. And when we have that happening, we can have poor vascularity, meaning the blood vessels and lymphatic vessels sometimes have difficulty moving through and around that scar tissue. The radiation fibrosis, just like the scar tissue from our surgeries, can cause the tissues to become less flexible and still have pain and discomfort and decreased range of motion. Both of these processes too can lead to lymphedema. And in my practice, I've noticed that gynecological cancers, some providers aren't as quick to recognize lymphedema, especially because it's usually in the lower leg or the upper leg. It can occur in intimate areas with swelling, like in the labia and up above the pelvic region. And when we have lymphedema, it's because there's been a damage in the lymphatic system because of the surgery and or radiation. And when that occurs, the ability for the lymphatic system to pull all the fluid and proteins back to our heart does not occur. And it gets kind of trapped and stuck. And a lot of times our gynecological cancer patients will notice it first in their legs or around their pelvic region. It can become chronic, and you might find in the beginning just that heaviness. And that's the time that we want to see you. And it can happen up for those first 12 months after your cancer treatment. I have seen people years later also. But today we want to kind of talk about lymphedema in terms of awareness, not to scare you that it is going to happen if you have to go through all this, but just so that you can be aware to be more proactive so that the sooner you can get evaluated and help, the less the symptoms generally occur. So with our gynecologic cancers, when we're looking at recognizing those early signs and symptoms after you've gone through cancer treatment, it might not be the visible swelling. You might not wake up and your thigh is bigger or your toes are bigger. It might just be a subjective sensory symptom, such as my leg feels heavy, or by the end of the day, I feel a little fuller, or it's a little tight up in my groin. Some people get that tingling sensation like in their leg and their feet because those nerves are compressed because they're starting to get swelling. You might feel a little full in your abdomen or your genital region. Your socks might start leaving an indent when you take them off. Jewelry or your shoes might feel tighter. For genital lymphedema, it's because it's such a more intimate situation, a lot of patients might not feel comfortable talking about it. But what you may notice is it's more uncomfortable to walk. It's more uncomfortable to sit because you're fuller or harder or firmer. Some people have trouble with urination. Sexual activity becomes more challenging because of the swelling.
Hey folks, I'm working off two screens here. So um, just as your journeys have differed in diagnoses and treatment and stages of recovery, et cetera, scar tissue and lymphedema treatment plans are also very individualized. Therefore, Melissa and I strongly encourage you to inform your oncology team and any other pertinent medical professionals when considering any of these strategies to ensure that they are safe and appropriate for your body. If your provider gives the okay, trust the process. Practicing self-care and self-treatment can reform a positive relationship with your body while reestablishing the management of your own care. Melissa and I recognize that you have likely never had formal training in any of the subjects that we are discussing today. So please remember that when it comes to these strategies, the goal is progress, not perfection. It's also helpful to know that following self-care and treatment options, that the following self-care and treatment options are beneficial for those who have either or both scar tissue and lymphedema, as both side effects can alter the body's soft tissues and its ability to circulate fluid. So hydration. Hydration is essentially the process of replacing water in the body. Adequate hydration levels affect skin and connective tissues while also supporting the systems that keep those tissues healthy and able to regenerate. Some simple ways to up your hydration and maintain it involve adequately maintaining your hydration with consuming 50 to 68 ounces of water a day. Again, something you may want to check with your providers about in the event that you hold fluid or have any kind of kidney situation, etc. The aim is to sip fluids throughout the day and to avoid drinking only when thirsty, because that will help prevent you from chugging or gulping water, which is less helpful in your overall goal to be hydrated. In addition to drinking fluids, hydration can be maintained by consuming hydrating foods such as cucumber, watermelon, zucchini. Moisturization is essentially the process of keeping the water stored in your skin cells because of your incredible hydration from evaporating or seeping out. Maintaining helpful moisturization levels in your tissues will limit and help prevent itching, irritation, but it also keeps tissues pliable and prevents skin breakdown. A helpful way to maintain skin moisturization is to use dye-free, fragrance-free, hypoallergenic mediums like creams and lotions. Make a habit of applying those to your skin after bathing. And Melissa and I strongly encourage you to always protect your skin from sun exposure, but don't forget to specifically protect your scars as well. Now, diaphragmatic breathing is a technique that aims to purposefully move the diaphragm muscle to create deeper inhalations and exhalations. Essentially, your diaphragm starts mid-chest and ends at your rib cage. It separates your heart and lungs from your stomach and intestines and all of the rest of those lower organs. Diaphragms growing and shrinking with your breath basically massages that cisterna chyli, that largest lymph node that you can see in the diagram, and that increases the flow of lymph. So let's practice that technique as it's fairly simple and can be done just about anywhere. First, I want you to try to purposefully settle a bit more comfortably into your seat. If you can place both feet on the floor so that you have a little more stability and feel a little bit grounded in that position. I want you to now place one hand on your chest and one hand onto the middle of your stomach, just below your rib cage, like towards the middle of that rib cage split, not like way down from the side of that rib cage. And I find that this helps me pay better attention to where that inhalation and exhalation movement is going to be in my body. So now when you inhale, do that slowly through your nose. And if you can, focus on your stomach expanding outward as opposed to your chest rising. So you want your breath to come into your stomach as opposed to like we're used to doing sometimes. If you see babies, they always breathe into their stomach. The breathing into our chest seems to come as we get older, and probably societal judgment. But when you exhale, do so slowly out of your mouth, and I want your focus to still remain on your abdomen, but your stomach should feel like it's flattening back in towards your spine. So as you breathe, occasionally turn your focus to that hand on your chest, as it should be relatively still compared to the abdominal hand moving with your breath. And you can use this breathing technique to help alleviate emotional symptoms as well. So if you are just feeling a little bit tightened up or anxious, anything like that, you can go through this movement and both calm kind of your nervous system along with helping to increase the lymphatic flow in your body. Now I'm forcing Melissa to talk about desensitization because it is a newer topic that I am incorporating in my practice. So,
Okay. So sometimes people experience what we call hypersensitivity after surgery, after radiation, after the trauma done physically to your body. There is a sensory and emotional component that comes into play as our body is trying to heal. And when we're looking at desensitization, we're trying to help the brain and the nervous system reprocess touch again. And the quicker we introduce desensitization, the less pain and aggravation and side effects you'll have later on down the road. So what happens is the nerves within the scar tissue can become overactive or underactive if there's some numbness, right? So when we start with gentle sensory input, it helps decrease that hypersensitivity and encourages tissue mobility. when we're looking from a lymphedema standpoint by doing the desensitization too, it helps us tolerate compression better, and it helps to stimulate when we're doing our manual lymph drainage. It helps to stimulate the the healing of our body and helps reduce that sensitivity. So with desensitization, we always want to start gently and slowly. And we usually start with a softer material, so something that feels good on other parts of your body. And what you're going to do is, depending on where that hypersensitivity, that ouchy feeling is on our skin, what you're going to do, let's say it's on your groin on your right side, you're right above your hip, right around your hip, where maybe you had surgery or you had radiation to those lymph nodes. What you're going to do is actually go to the opposite side where you didn't have treatment, where it feels normal. And you're going to rub that soft piece of material on that side and then rub it on the side that's more hypersensitive. And you're going to go slow and soft. And by going from back and forth from different parts of the body, the brain starts to remember what that good touch, what that non-noxious touch feels like, and then begins to incorporate that into its mapping, into how it interprets touch into the side that's been affected by your cancer. You can do this in the shower too. I encourage people to, use a soft washcloth, not necessarily those heavy loofah sponges in the beginning, but something soft, and then build up with your texture. And then you're going to go to something that's a little rougher, like that loofah sponge, like a towel, like a piece of denim, something that's a little more firm, and start doing that back and forth from side to side, or other parts of your body that feel normal to the side that doesn't, that's more hypersensitive. And the more we do it, the better it does get. And you're not going to do it for 10, 15, 20 minutes at a time. You're going to start with 1 or 2 minutes, and just to give your body a sense of what normal feels like again.
I told you I'd be back. So towards the end, Melissa will be addressing manual therapy for lymphedema. But we're going to look at some examples of scar tissue manipulation that you can provide to yourself. So scar tissue massage gradually breaks down adhesions while increasing circulation to and elasticity of that scar tissue. Again, we encourage you to seek medical clearance to begin working on scars, as too much too soon can act against your healing. So I have drawn a scar onto my hand. And feel free to visualize one on yourself. I'm going to take 2 fingers and place them onto the scar. And we're going to work through the motions on that left side of your screen. So with gentle pressure, you're going to move your fingers around in like small circles. And go clockwise, you're going to go counterclockwise, and just kind of loosen that area up. So you can try this out on your hand if you would like to. I'd really love to be seeing if people are giving this a shot. Next, you're going to work vertically or up and down over the width of the scar. So same kind of thing. You can move areas, but you're going up and down over that scar tissue. And then lastly, you'll end up moving your fingers horizontally over the scar, so side to side, across the length of the scar. Now, you can slightly increase pressure as your tolerance allows, but as most of the other things that we'll talk about as far as physically putting something or your hands onto your body, start slow, start gentle, start for smaller amounts of time. It's more is not more, typically, in any kind of like hands-on practice on yourself. Less is more. There needs to be a buildup. There needs to be a slow breakdown of the things that we're working on, because it usually didn't create quickly. Like if you have lymphedema, if you have scar tissue that is just really adhesed, Those things usually don't come on quickly, so they're not going to go away quickly. The skin stretching on the right side of your screen is going to look kind of similar to the motions that we just practiced, but you're going to be making those motions on the side of the scar. So you're working out away from the scar and kind of separating that skin in different angles, different directions. And if it's someplace on your body where you get to use both hands, you know, you can have one set of fingers on one side and another set of fingers on that. Oh, thank you, Melissa. Perfect. Excellent. So lastly, I am going to demonstrate the skin rolling. And I chose my hand because that is not where I need any of this information to be, actually. So the skin rolling on the hand is a little bit easier to visualize because there's like looseness typically here, where sometimes you won't get the same looseness on a different part of your body. So this is just good for visualization. So you're going to gently lift your skin up, and it can feel very pinchy. So if this is not a tolerable feeling to you, even in this practice, it is likely not going to be tolerable to a place that is more sensitive for you. So, but you're going to kind of just barely lift up that skin, and then you can try to roll it back and forth in your fingers, and you should feel that that skin is separate from the rest of the tissues in your hand, like your muscles and ligaments and things like that, that should be firmer and like not as easily yanked around. So practicing that rolling on that skin, you can do it with multiple fingers. So like supporting with that thumb and rolling across, this may be easier. Just kind of trying to roll that skin across. And what that's going to do is break up those adhesions. For sure, also bring a little desensitization in, and otherwise just make that scar tissue more malleable when typically it is not.
So at home, there are some other ways we can manage our scar tissue and actually lymphedema. If you come to a clinic for like a PT or an OT, sometimes we have different modalities like ultrasound and things that can bring in more vibration. But one of the things that's worked really well for people with lymphedema and scar tissue is working with a handheld massager. So you buy them on Amazon, they're really cheap. There's just a push button. And the biggest thing here when we're working with vibration, you're going to do it for 5-10 minutes at a time. And what you want to do is not do it on your bare skin because it does not smoothly glide, but you want to do it so that it's on actual material like a t-shirt or a pair of like simple leggings that are loose and light, and you're gonna push in to the point where it doesn't hurt. No pain is allowed in this. This is just to kind of loosen up the scars, loosen up the lymphatic congestion, and you can go throughout. If it's on your leg, start at the top of your leg, move down to your feet and back up, or just if you want to focus on wherever your scar is, not pressing too deeply. This will also help with desensitization too with your vibration. And you're just going to do it for 5-10 minutes at the most, but you might need to build up too. You might need to start with only a couple minutes and just work on it. You can have somebody help you if you prefer, if you can't reach certain spots on your body. But a simple handheld massager is a great way to get some vibration, get some movement in a different modality, um, and adding on to what Paige had recommended just a little while ago. So besides the diaphragmatic breathing that she did such a great job demonstrating, um, the deep belly breathing also helps with some of those abdominal pelvic scars and helps with, like she said, move lymphatic fluid in your abdomen. Besides that, though, we can do for lower extremity for your lower body, if you have lymphedema or the scarring, is doing more leg pumping, more muscle pumping through either walking, bike riding, Rebounding, which is like the mini trampolines, basic leg exercises. Swimming is a great way to get in the water to help with movement, to help move lymphatic fluid. It's one of the best exercises you can do and protect your joints. But movement within your pain tolerance, we don't want to increase pain. And in the beginning, you'll be starting gradually. You'll do the stretches that your therapist recommends. And I would highly recommend you seeing a therapist to create a treatment plan that's specific for your needs, where your tightness is, where your scar is, and if you have lymphedema, how to best manage it. But when we move and we stretch and we exercise, we pump more blood to our tissues. We work on stretching those tissues in ways that are functional so that we can be more comfortable. So we think of lymphedema, that chronic swelling that's not going away on its own. Daily compression is very important. And you could do a whole lecture on compression garments in itself, but you should be fitted and measured by a professional, whether it's someone that's at a durable medical equipment place that can measure you, or a lymphedema therapist that can measure you, because improper fitting, if it's too tight, actually causes more damage. It should feel comfortable. It should feel like a hug on you. You may have to build up tolerance for dealing with new compression if you're not used to it. But it should never be so uncomfortable that you want to rip it off right away. And there's different types of materials. There's flat knit, there's circular, there's lots of options depending on where you and your therapist decide you need what your needs are. But there are lots of options. People who have trouble with grip strength and pulling on stuff or can't bend over as much, they've created Velcro compression wraps that can do the same things, only in a different way that's more manageable for you. So definitely talk to your provider. If you suspect you might have lymphedema, so that you can be further assessed. And then if you need compression garments to help manage any type of swelling, they can help you. And what I want to mention too is, and this is towards your supplemental, if you have the slides, are what we call swell spots or chip pads. And what we do is we add them to our garments, and they're these nubby little soft foam that can be washed. And they're really good for parts that are like fibrotic. I've had people who've had to wear them like in their underwear if their labia is firmer, just to kind of break up, or right above or right below on their pubic area. Like sometimes if it's hard and firm, there are things you can add to your garments, to your underwear, to your pants, that will help soften it so that when you move and you have these types of compression on, these swell spots, what they do is they help break down the fibrosis. They help move lymphatic fluid. Another way we look at moving lymphatic fluid is through manual lymph drainage. And that's a light touch technique that helps move that fluid and reroute the fluid out of your limb or your congested area. A certified lymphedema therapist specializes this and has specialized training. It should never hurt. And someone who performs this on you is a great way to move that lymphatic fluid. And then the therapist can train you how to do it on your own at home. So optimally, if you have lymphedema, you do it once a day. I find my patients, if they have lymphedema in both legs, sometimes starting out with just one, practicing instead of overwhelming yourself trying to do everything. So all these techniques and all these different strategies that we're telling you today, don't feel like you have to do all of them at once, that you have to incorporate everything at once. It might be picking and choosing. It might be reaching out to your provider to find a therapist to help you manage these step by step. But if you've done the manual lymph drainage and you want more from home, and you can look at, they do make pneumatic pumps. These are specialized pumps that mimic lymphatic drainage that a lot of patients find as a helpful tool for long-term management, because lymphedema is a chronic condition and we want to manage it the best we can so it does not get worse. And those are some references.
I also wanted to say to Melissa's point about not having to do all of these strategies at the same time. Some of you may find that you go to work on something that is least comfortable on you and find that maybe it's just not something that you can tolerate. So it may be worth, much like the desensitization and going back and forth from another area, kind of trying some of those tactics someplace that is not as uncomfortable, to one, kind of learn them and hone them and get them a little bit better in your toolbox, but also to create that calmness in yourself and your body to try out some of those other strategies and be able to work towards the areas that you feel that you need them the most. The end.
Okay, well, we have a few questions so far, and more may come in. I also know that you have these additional supplemental slides. So if we have time, we can look at them, or now you all have the link. I dropped that into the chat for their slides that have all the additional stuff. So if anybody at home wants to look at it, it's there as well. All right. First question. What tests can confirm internal adhesions or fibrosis? CT or MRI or others? Are there tests that can?
A lot of times internal tests like those type of scans don't show it. It's more of the feeling of tightness, or having, like, if you pressed on your abdomen and you're like, oh, that's resisting, it's not nice and soft and squishy, or you're having complications with your digestion or urination, um, even bowel movements, depending on where the surgery was taken place. Those restrictions internally, that's how you would sense it. But a lot of times people feel that tightness just in their movement, or if they go to turn and they're like, ow, that catches, or that doesn't feel right, it's not as smooth as it used to be. That's how we kind of do it. And therapists like Paige and myself, we've been trained in that touch to kind of be able to find those adhesions.
Yeah, you guys need to remember that we're putting our hands physically on bodies all the time. And so though something may feel the same to you as if you put your hands on somebody else, because we have had so many different textures and muscularity and things like that under our hands, we can kind of suss them out sometimes differently than maybe you would be able to. I'd also add to Melissa's point, if you have a change in that discomfort with sexual activity, that's another thing that could give you an idea that maybe there's some adhesions internally as well.
Okay, the other part of that question was, can internal adhesions and fibrosis be removed surgically?
Usually not, no, because when we go in, if a surgeon goes in to take out scar tissue, it creates more scar tissue, because the body's like, oh, we have an opening, let's close that up, and actually it can do more damage because then it becomes firmer or it can become more encapsulated. So unless, of course, they're doing some type of clean out, where they have to do something around the organs or something, a lot of times they leave the scars alone. That would be something that you can talk to your oncology surgeon about, especially that they could better assess what's going on. But I haven't seen a lot of that because it just creates more inflammation, more scar tissue that the body likes to create.
And we absolutely understand that you want like a faster resolution to your pain and discomfort, and maybe not being able to get back to activities you typically like. But there's also, your body has done a ton thus far to, work you through treatment and, heal things and make everything better. That it also deserves some grace. And so do you as a person. So I would, consider it that way, that this work to kind of remove these uncomfortable situations is also like kind of building you back up. So surgery is super invasive, where something like fibrosis work or manual therapy, something like that, is feels much differently supportive to your body than invasive.
Okay. Is it possible, like with those internal adhesions, like a lot of the strategies that you shared were sort of external strategies, can those sort of penetrate and have an effect on, unsticking the internal adhesions, or are there other strategies that were in that supplemental part of your presentation that we shared in the link that people could practice?
Yeah, so back to that diaphragmatic breathing,
Mhm.
huge help for one, getting that lymph to flow, which is lymph like is your immune system. So that's important anyways. But the fact that it's working on those abdominopelvic muscles and that it's moving around your organs, that all of that breathing is literally affecting everything basically in your torso. It is working and massaging and stimulating and loosening all of those areas. So that's an excellent way if it's if you're looking for something to do for yourself. If you went to, maybe you need to look into a pelvic floor therapist specifically, and then they would do more physically internal work, potentially through your vaginal canal or rectum, different things like that to loosen up those adhesions inside. But as far as something that's just overall excellent for you to loosen up a majority of those areas, it's that diaphragmatic breathing.
Yeah. And yeah, it's amazing the more that I learn about how that helps to soothe your nervous system. And, all of these processes are full of trauma. And, that can store tension in all of those ways and probably cause greater inflammation, greater fibrosis,
Yeah.
greater adhesions. So it's just this feedback where you can start to put some of these strategies into place that you've shared and start to feedback in the other way.
Yeah. I will also say that as you do any of the manual therapies, like we were talking about with like the circles and vertical and horizontal movements, um, that as those top layers soften, you're going to be able to go deeper, and those will end up being more internal areas that you can reach that way as well. So,
Actually, I did want to ask quickly about the manual therapy strategies because I was sitting here practicing. I know you can't see all of our faces, but I wondered because you said to start very gently. So you said gentle pressure. So should that be firm enough? I couldn't tell if you were like moving the skin fully or if it should slide over as
well, it kind of depends, and Melissa may be able to speak differently to this, is depending on what your sensitivity on that scar is, it may be worth using like a medium with it. So like a lotion that, you're not allergic to or, smells delicious if that's what you feel like that day. And because your skin to an extent will move, but it doesn't necessarily mean you have to move over the scar specifically. So it's layered where like your skin basically floats.
Mhm.
And sometimes that fascia, which if you think about raw chicken, it's that like little weird layer over raw chicken that's over all of our organs, muscles, everything, and it connects all the things together. But sometimes that layer can make the skin adhere to it and like get kind of like sticky and stuck. So depending on your body, some of those areas that you do this to, it's going to slide. And some of those areas, it's going to be more like, okay, maybe I just need to kind of sit here for a little bit and then maybe it moves a little bit better. And you can always just kind of like hang out again gently in that resistance. And then you may feel that shift. And the next time you go back and do it, you may not have to hold that resistance the same way on that tissue.
That's helpful to know. Um, I wanted to make sure that we chose these topics. This is our GYN series, but the topics that were chosen, I tried to make them as broad and applicable to our entire community here at the coalition as possible. So there was a question about would the same principles apply to self-treatment if someone's dealing with lymphedema in their breasts following mastectomy, especially with regard to a handheld massage like a vibrator?
Yep. And that's I guess the nice thing about this topic is any part of your body where you've had the damage done from surgery or radiation. Each person is different in terms of how it feels when they do these techniques. In a breast, depending on how soon after you've had surgery and radiation in any part of your body, you might have to start gentler. And with breast lymphedema, you can, they do make compression bras. They do make things you can put in the bras to help with that radiation fibrosis or that thickness or that fullness from the lymphedema. And activity and movement for people with breast lymphedema, trunk lymphedema, arm lymphedema is good too. It helps move things along. Stretches are still important for people who might have more chest tightness from a breast treatment. So it does apply to the same way. It's just you want to create something that feels good. You've had so much trauma done to your body that if it doesn't feel good, then stop. It's not worth it, you know. And even when you're working with a therapist, if it doesn't feel good, speak up and say, this really doesn't make me feel good. Because that's so important in this process of living after your cancer treatments and recovering and healing. So it should always feel good no matter what techniques on whatever part of the body you're using it on.
Yeah. And it doesn't mean just like in your brain, the whole point of pain is to alert us to something that should not be happening. So that is where you need to make sure that you speak up and are truthful with yourself so that, I mean, discomfort, okay. Pain, not okay. Like different sensations that are not something that you experience all the time, maybe not great. And as always, like defer to your team, defer to your medical professionals. If you're like, okay, I was doing this and this happened, do I continue doing that? I took a break from it. My skin didn't get too upset, like just questions like that to ensure that you're appropriately communicating with them so that they know what's happening with you, but also can give you feedback and make you feel more confident in it.
Yeah, I'm really grateful for a couple things. The distinction between discomfort and pain, I think, is a very individual thing that can
Yeah.
change moment to moment, day to day.
Area to area.
Yeah, and growth and progress, like you were saying, not perfection, but progress can be uncomfortable sometimes. But trying to figure out where the boundary is between discomfort and pain, like everybody needs to listen to their bodies, and having that open, honest communication with the people that are helping care for you can be really difficult. This is very vulnerable and intimate. And so finding amazing people like you, I know not everybody can come see you. So trying to find people that you feel comfortable telling honestly, like, I am having some struggle with XYZ thing right now, like, or that actually really hurts. I can't handle that. Whoever you feel comfortable to see on an ongoing basis to get help with these things is really important. So
Yeah. And some ways that you can distinguish the two, because like a stretch might feel uncomfortable and be like, ow, but pain, think of it as a takes your breath away, like, oh, that hurts. Not like, oh, that hurts, that's tight, but
Mhm.
oh, that really caught my attention. So that's one way I kind of describe to people, because after surgery, after radiation, after immobility, we do tighten up. Our tissues do tighten up. They contract, they get a little tighter, and we sometimes do have to push it slowly to kind of release it. So it might be oh, that's uncomfortable, but is it taking my breath away? Am I seeing stars? Am I getting lightheaded? Is this really creating nausea some people get, Is it those extremes, or is it, oh, that just doesn't feel good, but I can take a couple deep breaths and work through it.
Or creating more symptoms than what you have, creating swelling, creating redness, creating irritation, like those are situations that are exactly the opposite of what we're trying to do. And I'd also view the recovery, healing, getting back to a baseline or a new baseline as a like long-term like goal and work. And again, everybody wants the quick, fast, easy thing, but this is the body you get, and we haven't figured out how to re-up all of the parts. So make sure that you are basically best practicing the things for your body. So when you're going to work on yourself, or if you think it's kind of out of your ability, seek other people to have that conversation with, so that maybe you do get a quicker result from coming to see Melissa for something that you're not getting completed the way that you would like to get completed, and have somebody else to kind of bounce that information off of and be like, should it feel like this? Have you heard this from other people? Is this discomfort or is this pain because maybe my tolerance is a little bit lower? Various things like that.
Okay. That's very helpful. Another question was asked, would you recommend the use of suction cups for scar tissue therapy? Suction cups can help to raise or separate scars from the tissue below, potentially.
They can. They cause negative pressure, which helps to separate. The concern with someone just going out and getting suction cups is they do it too hard. They damage more skin because when you do certain techniques, you increase circulation, you increase certain blood flow. And if you aren't trained in how to properly use the materials and how to use the techniques, you could cause more damage. So when I work with patients, I do teach them how to use suction cups for long-term management of scar tissues, but it's after I've done it multiple times and after I've actually showed them. I wouldn't trust necessarily a YouTube video, because you need to feel what the proper pressure and the proper glide or technique or the suctioning is. But it's a very good technique. It's a good negative pressure. Someone described like all our skin tissues like baklava, and they're all just kind of down and sticky, right? And when we put a suction cup on top, it helps to separate. And that helps with that circulation and getting to the yummy gooiness of the underlying tissues. But it's one of those things that can be done improperly and cause more damage. So I would definitely consult somebody who's been trained or who uses them, that you can feel comfortable with, to get that guidance. But it's totally a great thing. We just didn't want to put it on there for this because I don't want everybody going out to Amazon and buying suction cups and then
Agree.
walking around Rochester with all these red rings around them.
And for those of you that don't know, they are more bell-shaped. It's not like the suction cup that you would put like on a window. It's not flat like that. It's something where you like can either use a pump to remove the air, or like squish it with your hand so it creates that negative pressure. But it is not like, certainly don't get like window suction cups. If someone then allows you to or suggests that you should be using these. So that's all of that kind of misinformation exists. So another thing where please talk to a provider.
You're a professional. All right. I never thought that my love of the Great British Bake Off with lamination would actually be a useful thing to have binge watched during the pandemic, but I totally understood what you were talking about. Okay.
You want those layers to all be identifiable.
Lamination. I was also curious. So it sounds like, talking about pelvic floor PT, and we were talking about the like canister with your diaphragm and the pelvic floor and how these things work together in the body. And then you sort of talking about how diaphragmatic breathing can help with lymphatic drainage and all of these things. It seems like all of these therapies could be very complementary with one another. Is that accurate? Like you could go see a pelvic floor PT, you could go see an OT, you could go for massage. Is it important to, first of all, is it correct that all of these things could work together in concert?
Yeah. Yep. And like, so my training is different from a pelvic floor. Their scope of practice for that is like more internally. I do all external, even on a labia or, a pubic area for that scar tissue. Yeah, I'll do the treatment. Manual techniques will also be done. But I let the experts deal with more of the internal, but they can go together. And a lot of times, what's going on the outside is just the surface of what might be going on the inside. So both together complement each other for those type of things. And if there's lymphedema involved, not all pelvic health floor people can specialize in the lymphedema portion. So we definitely give and take from each other, and it's a good community, to reach out and say, hey, do you know a good whatever type of therapist?
Yeah. I'll also say, at the expense of my, career, that I always try to encourage people to go through their insurance first, because massage therapists cannot accept insurance, except typically for maybe sometimes like, not workman's comp, sometimes workman's comp, but like, no fault sometimes as well. But, there are also times that if you have a higher deductible, something like that, that maybe massage is a better fit price wise than trying to go and get into a PT or OT or someone else that is allowed to accept insurance. I will also say that sometimes the wait can be longer for people trying to get in with insurance. And just because someone accepts insurance does not mean that they have the same training as, like someone that does not in the things that you are looking for. So for sure, due diligence, again, asking providers who they like to refer out to or have heard great results from, asking other people like at the coalition, if you're doing support groups, asking around there and seeing who people have, had a really helpful time with, especially within the same type of maybe oncology area, like gynecological versus breast versus, ask people that have kind of a like diagnosis and see who they've gone to and had success with. So
Somebody asked, on the topic of insurance, if you don't have insurance, what should you do? And is there ever, I don't know, options for a sliding scale or like for folks who are struggling but need support? Are there any options for them?
The hospital systems, like Strong and RGH, they sometimes have those financial care plans that help people to see therapists if insurance doesn't cover it or there's financial hardships. Private practitioners like myself don't have that ability to absorb something like that, but the bigger hospital systems do make the ability for patients to receive treatment with the financial assistance. So I know that option is out there. I'm not sure.
I will say personally, because I accept credit card payments, I've got a lot of people who will use their FSA or HSA cards or benefit cards or whatever the new 7 names are. But because I am in the Square system as a medical-based practitioner, I don't typically get any pushback. I don't even typically have to send out anything different, specifically like what I did as far as a treatment note or anything. I don't have to typically back up what I've done. So that is sometimes an option. Also, just kind of shopping around therapists as well, because not all therapists are charging the same amount for the same service.
In private
In private setting, yes, in a private setting, excuse me, insurance aside. And also because I work in that program, U of R has a integrative program that if someone is in current oncologic treatment or has maybe a little more complicated diagnosis, you can get some complimentary massage or acupuncture, and they've got a couple other like group classes that they offer free of charge and are the only integrative center in the country that is completely complimentary, that patients do not pay for those treatments. But that is not something, unfortunately, that you guys can just like come in off the street and have at a lower cost or no cost. That is specifically within that system, but certainly something to look at if you're within the URMC system.
Yeah, that's wonderful. Thank you for mentioning that HSA and FSA is also possible to use.
Yeah.
And maybe, as was mentioned, looking into insurance as a future topic is something that we could dig into because it is a mess. But anyway, we are out of time. Thank you both so much for everything that you do, all the support and hope that you offer and quality of life. This is a big deal. So I'm really glad we're talking about all these things. Thanks to all of you who were able to join us this afternoon. Next week, we're actually going to be talking about menopause and cancer with Dr. Maureen Slattery and Dr. Nikki Rubin as we continue our Wednesday webinars at lunchtime from noon to 1 throughout the rest of September and all through October. So hope to see you all then. Thanks, Paige. Thanks, Melissa.
Thank you so much.
Thank you.
See your faces, and we'll see each other hopefully again soon.
Yes.
Take care,
thank you.
everybody.
Everybody have a good day.
You too. Bye.